Hi, my name is Emma Bailey, and this is my honors presentation, Hyperthyroidism, a tale of two case studies. I did this presentation for my Anatomy 102 class with Dr. S. In this presentation, I will cover the structure and function of the thyroid gland, signs and symptoms of hyperthyroidism, a case study of hyperthyroidism from the 1700s and a case study from the present day, similarities and differences between these two case studies, and I chose this topic because I thought it would be a good way to combine two of my interests, science and history. And it's also interesting to study how our understanding of the human body has evolved through the years and how we are still learning new things about it every day. So what is the thyroid gland, you may ask? Well, it's located in the anterior neck, inferior to the larynx, which is one of the structures of the respiratory system. It is the largest pure endocrine, or ductless, gland in the body. It's part of the endocrine system, which secretes hormones in order to regulate functions in the body and maintain homeostasis. The most important hormone that the thyroid gland secretes is thyroid hormone. Go figure. Thyroid hormone does many important things and influences all of the body systems in some way. But today I will be focusing on its ability to regulate metabolism. Metabolism is the process of converting food into energy the body can use, which in our case is ATP. And the picture on the right illustrates the activation of the thyroid gland. On a cellular level, the thyroid gland is composed of follicles. As you can see from the picture on the right, the parafollicular cells secrete calcitonin, which has the effect of lowering blood calcium, and the follicular cells secrete thyroid hormone. The central cavity, or lumen, of the follicle stores colloid, which contains the prohormone thyroglobulin. What is hyperthyroidism? So the prefix hyper means excessive or overactive, so hyperthyroidism would be overactivity of the thyroid gland. One possible cause of hyperthyroidism is Graves' disease, an autoimmune disease caused by the presence of antibodies to TSH, or thyroid-stimulating hormone receptors. So TSI, thyroid-stimulating immunoglobulin, acts like TSH and tells the thyroid gland how much thyroid hormone to produce, causing it to produce more than the body actually needs. Hypersecretion of thyroid hormone just amplifies the regular effects of it. So instead of a normal basal metabolic rate, or BMR, you get one that's higher than normal, and that's very important for the case study that we're going to analyze next, which is why I highlighted it on this slide. And you also have a higher body temperature, appetite, blood pressure, etc. There's an excessive movement of the GI tract, which causes diarrhea, and skin is flushed and moist, hair is fine and soft, and nails are soft and thin. And there are other symptoms on the slide too that don't really pertain to what we're talking about today. So this first case study is about a man named Tarare. Buckle up. Tarare was born in the late 1700s in the French countryside just outside the city of Lyon. As a child, his appetite was insatiable, and his parents ended up throwing him out of the house because they could not afford to feed him. For the next several years, he wandered France and became the warm-up act for a traveling charlatan. He would swallow stones, corks, and even live animals. During the Revolutionary War of France, Tarare joined the army. Military surgeons were amazed by his appetite and ordered that he stay in the hospital for several months to take part in physiological experiments. It doesn't end well. So during this stay, Tarare ate a meal prepared for 15 men, devoured a live snake by, and I quote, tearing its abdomen with his teeth and drinking its blood, rest in peace, ate live snakes, lizards, puppies, and other animals. He had a brief career as a spy, which I'm not going to get into, and returned to the hospital. Sadly, all attempts to heal him failed. They restricted his diet at the hospital, so Tarare snuck out to fight the stray dogs in the streets for scraps from the butcher, and drank the blood from patients treated with vivisection. The doctors put up with this behavior for quite some time, until a 14-month-old child went missing from their room. And I will leave that to your imagination. What perhaps could have happened to that child. We don't know for sure, but I think we all kind of know what happened to the... Okay. About 5 years later, Tarare died of tuberculosis. His corpse decomposed at an alarmingly fast rate, and at his autopsy, his rotting entrails were bathed in pus, His liver and gallbladder were very large. His stomach filled the majority of his abdominal cavity, and his gullet was uncommonly wide, meaning that they could look down his throat and see into his stomach. Back in the day, they had no diagnosis for Terrare, except the old "he is possessed" shtick, and now doctors suspect that he had hyperthyroidism due to him having so many of the symptoms. His BMR was above normal, so he was always hungry. His body temperature was above normal, so his skin was flushed and he had an intolerance for heat. He had diarrhea, his hair was fine, and his nails were thin. And the doctors attempted to cure him with tincture of opium, sour wine, tobacco pills, and Levantine soft-boiled eggs, which is apparently some exotic food. And Terrare's doctors obviously did not treat him ethically. I mean, they fed the man live animals just to get their sick kicks. And they starved him, which obviously was not going to improve his condition. Alright, so now we're going to go through a case study from modern day, which is a lot more chill, as you will see. So, a 72-year-old man comes in and he has the following symptoms: insomnia, fatigue, medical history of degenerative joint disease, no weight loss, anxiety, or urinary problems. His blood pressure is 140/75, his pulse is 85, his respiratory rate is 20, his temperature is 97.1, and his TSH level is 0.03 milli-international units per liter. This subtle presentation with few symptoms is actually quite common in older individuals with hyperthyroidism. In younger patients, like Terrar, manifest a number of signs and symptoms. This is a flow chart describing the tests the doctor should order if they suspect that their patient has hyperthyroidism. The first thing they would do is test the patient's TSH levels, which should not be below 0.5 milli-international units per liter. I practiced that. Older patients, like the one in this case study, usually have a higher than normal TSH level. So if his is below 0.5 milli-international units per liter, then you know that something is definitely wrong. So after performing that test, the doctor can go from there to narrow down the exact problem with the patient. And this chart lists the common causes of hyperthyroidism and the clinical and laboratory findings associated with it. Notice how it mentions Graves' disease, which we brought up earlier in this PowerPoint. Sorry, that's just my dog. There's no one here. This chart lists possible treatments for hyperthyroidism, like antithyroid drugs, radioactive iodine, and surgery. So now it is time to compare these two case studies. There is a stark difference between these two cases in terms of possible treatments. They attempted to treat Terrare with opium and tobacco pills, whereas the old man from the other case study could have been treated with antithyroid drugs, radioactive iodine, or surgery. To start with, Graves' disease was first described in 1786, and the first thyroidectomy, or thyroid gland removal, was performed in 1880, and the two other treatments available to those that suffer from hyperthyroidism today weren't discovered until the early 1940s, so way after Terrare's time. And it just makes you think about how many cases of hyperthyroidism back in the day went undocumented, and the sick just had to suffer without any hope of treatment. And also, doctors treat their patients more ethically nowadays. In Terrare's case, the doctors experimented on him and let him starve, and in the modern-day case study, the patient would not be put through these sorts of things, one would hope. Now it's time for a reflection period. So what was interesting about this project for me was seeing how much the medical field has changed over time. And I think that history and medicine go together so well because we build upon knowledge of the past to create the knowledge of today. Thank you so much for listening to this whole PowerPoint. I'd like to thank my audience, of course. I'd like to thank Dr. S., who was so helpful during this entire process. I would like to thank my dad for emotional support. Of course, my dog, being such a good audience member. These are my works cited. Thank you for coming to my TED Talk. See ya.